Well, it's good to have you back. Today, in our Toolbox series, we're going to talk a little bit about turmeric and curcumin, what they are, what are their differences, and their medical use. I don't have any conflicts of interest for this class. This is a bit about myself. So the topics of this class will be number 1, what is turmeric and what is curcumin and their differences. In the second part, the biological mechanisms of curcumin and curcuminoids. We're going to talk a little bit about that. We're going to talk about the actual practical use of curcumin as a medical substance. And we're going to talk a little bit about the precautions we need to have when using curcumin for medicine. An observation, some parts of this class are more technical, more dense. They will be pointed and they can be skipped. There will be timestamps in the description if you're not interested, but they are nice, so I encourage you to watch them. But without further ado, let's go. Our first topic will be to talk a little bit about turmeric and curcumin. Well, turmeric is a plant. Its scientific name is Curcuma longa. It's a plant native to India and Southeast Asia. It's been used as a spice, as a dye, and for medicinal purposes since at least 500 BC. There is some debatable records of even older use, but it's reasonably established since 500 before Christ. And here we have a picture of the turmeric flower, some of the leaves of the turmeric plant, and here we have a photo of the roots of the turmeric. And the roots of the turmeric contain molecules we call curcuminoids. These molecules give the orange color to the root. If you notice that this root is very similar to ginger, this is not by chance. They belong to the same scientific family. That's why their roots are so similar. But in the roots we have some molecules that we call curcuminoids. Well, let's talk a little bit about these molecules, the curcuminoids. They are a type of nutrient that is present in the root of the plant. They are a type of polyphenol. About 3% of the dry weight of the root is curcuminoids. There are 3 main curcuminoids. Curcumin, which is the most famous one, dimethoxycurcumin, and bis-dimethoxycurcumin. In supplements, we usually have all 3 of them in varying quantities, and most of the time curcumin is the main one, and the other 2 are present in varying quantities. So, to recap, turmeric is a plant. In the roots of this plant, we have some molecules called curcuminoids. Curcumin is one molecule of this group. In this presentation, I'll be using curcumin and curcuminoids interchangeably because most of the time we'll have a combination of these 3 curcuminoids in the supplements we use for medical use. Being curcumin the most important one. So sometimes I'll be using the word curcumin, other times I'll use curcuminoids. It's interchangeable. Well, now let's talk a little bit about the biological mechanisms of curcumin. The information of this section is mainly from laboratory studies. Well, the general mechanisms of action of curcumin are very inspecific. Curcumin acts in many different pathways simultaneously. It acts on pathways related to inflammation, to mitochondrial function and oxidative stress, to neurotransmitters, to cellular reproduction, among many others. It can also act as a prebiotic. It can serve as a nutrient for beneficial microorganisms of the microbiota, particularly the microbiota of the gastrointestinal tract. Some more mechanisms that curcumin acts are mechanisms related to lipid and glucose metabolism, mechanisms related to weight control, mechanisms pertaining to endothelial function. The endothelium is the innermost layer of the blood vessel. If you think about the blood vessel as a pipe, the endothelium is the innermost layer that's in direct contact with the blood, and many of the effects on this endothelium is related to the cardiovascular effects of curcumin. Many of these mechanisms related to oxidative stress, mechanisms related to the control of inflammation, to endothelial function, to the metabolism of glucose and other nutrients, are involved in many diseases. That's why curcumin is studied in so many different conditions. But there also appears to be some specific action of curcumin in mechanisms of specific diseases. So curcumin acts on some pathways that are present in many diseases, but on specific condition, curcumin also appears to have specific effects. If you want to know more about these disease mechanisms that are present in many different conditions, you can check out the health and disease classes. Well, now comes the first technical part. We are gonna talk about some examples of the mechanisms of action of curcuminoids on specific diseases. You may skip this part if you want. Well, first beginning by neuropsychiatric health, we're gonna talk a little bit about the effects of curcumin on Alzheimer's disease. Well, it has a beneficial effect on inflammation and oxidative stress. You will notice that in almost all the cases, there will be a mention to the effects of curcumin on inflammation and oxidative stress. I'm not going to keep repeating this all the time, so it will be written on the slides, and you can assume that most of the time the beneficial effects of curcumin on inflammation and oxidative stress will be beneficial to a particular condition, even if I don't verbally say it, because inflammation and oxidative stress usually play a role in most of the pathological conditions. But more specifically to Alzheimer's disease, curcumin also appears to have a beneficial effect on some specific disease mechanisms, like the deposition of beta amyloid and the formation of neurofibrillary tangles of tau protein. So we have neurofibrillary tangles of tau protein and beta amyloid deposition. These are, let's say, the hallmarks, the most specific characteristics, let's say, of the pathological mechanisms of Alzheimer's disease. There are a lot more things going on, but they are some of the most studied characteristics of this disease. Curcumin also has some action modulating the degradation of acetylcholine. Acetylcholine is a neurotransmitter that is involved in many cognitive or intellectual processes. Acetylcholine is degraded by an enzyme called acetylcholinesterase. Many of the medicines we use to treat Alzheimer's disease act by inhibiting this enzyme. And in laboratory studies, curcumin might play a significant similar effect. Now about Parkinson's disease. Beyond inflammation and oxidative stress, in laboratory studies, curcumin also appears to improve dopamine availability. Dopamine is another neurotransmitter, and problems on the dopamine metabolism is one of the hallmarks of Parkinson's disease. So this is a beneficial effect in this scenario. Also, the effect of curcumin on the microbiota of the gastrointestinal tract is also very interesting, because Parkinson's disease in particular has a very close relationship to the function of the gastrointestinal tract, particularly of the GI microbiota. So a beneficial effect on the microbiota is very interesting for patients with PD. About migraine, the main effects appear to be on inflammation and oxidative stress, and migraine is one of the conditions in which curcumin is most studied in humans, particularly in the formulation known as nanocurcumin. We're going to talk a little bit more about this on the next section. Now, talking a little bit about depression. Beyond inflammation and oxidative stress, curcumin also has other effects, like, for example, enhancing the appropriate availability and action of neurotransmitters. We now know that depression and anxiety have much more going on than just a deficiency, a lack of neurotransmitters. We now know that there is neuroinflammation going on, that there is oxidative stress going on, we know that there are problems regarding the expression of DNA, excitotoxicity, among many other pathological mechanisms. And we can see in this picture right here that curcumin might have a beneficial effect in many of these pathological processes. One of the most important being that it inhibits excitotoxicity. What is excitotoxicity? When a neuron is overstimulated, it causes a detrimental effect to the health of that neuron. Over time, it damages the neuron. We call this detrimental consequence of neuron overstimulation excitotoxicity. This is a process that is present in many different diseases, many neurodegenerative diseases, but also in depression and anxiety. And curcumin might have a beneficial effect on this. So, regarding neuropsychiatric health in general, we have beneficial effects on inflammation, on oxidative stress, and on many other metabolic processes we can see here in this picture, but this is mainly in laboratory studies. We will see how this translates to the effects on human health in actuality. A lot of this evidence is from laboratory studies on animal experiments. We'll talk a little bit more about what we have of data on humans a little bit forward in this presentation. Now about cardiovascular health. We have effects on inflammation, oxidative stress, on glucose metabolism, on DNA expression control. The beneficial effects of curcumin on these pathways, along many others, makes curcumin potentially beneficial for patients with atherosclerosis, being that in cardiac vessels, in carotids, in the limbs, in bowels, or in any other site that atherosclerosis may develop. It might be beneficial on non-alcoholic fatty liver diseases. It might be beneficial for patients with non-alcoholic fatty liver disease, and even on situations like polycystic ovary syndrome, that even though it's very connected to sexual hormones, to the endocrine function of female patients, it also has a lot to do with energetic metabolism, of the metabolism of glucose, of lipids, insulin resistance, and we have a beneficial effect of curcumin on this regard. For example, we have a lot of studies of curcumin being beneficial on diabetes. It inhibits pathways related to the development of complications of these diseases, and it might also improve the glycemic control of these patients. We have improvements and benefits for patients with fatty liver disease, mainly non-alcoholic fatty liver disease, even though we have some evidence that curcumin might be protective against alcohol intoxication. But most of the data we have for non-alcoholic fatty liver disease. That happens because of the beneficial effects on inflammation, oxidative stress, and many other of the processes we have already mentioned. And as we will see, fatty liver disease is one of the conditions for which curcumin is most studied in humans. We have, now talking about gastrointestinal health, beneficial effects on gut microbiota. Curcumin stimulates the reproduction of beneficial strains of microbes in the microbiota, it improves barrier function, and these two things in turn promote other benefits. That benefits not only the GI tract, but the entire organism. In many different conditions, we now know that the health of the gastrointestinal tract, in terms of barrier function, in terms of microbiota, in terms of gastrointestinal inflammation, among many other conditions, is linked to diseases that happens in many other sites of the body. It's related to neuropsychiatric health, it's related to cardiovascular diseases, it's related to autoimmune disease, it's related to respiratory disease, it's related to joint conditions. What happens in the GI tract doesn't stay on the GI tract. The GI tract is one of the main axes of communication that has an influence on the condition of the entire organism. Talking a little bit about inflammatory bowel disease, we have benefits on inflammation, oxidative stress, improved barrier function, and improved immune tolerance. Inflammatory bowel disease is an autoimmune disease when the immune system attacks the owner's body. Immune tolerance is the capacity of the immune system to not attack the organism. So improved immune tolerance is beneficial when we think about autoimmune processes. We can keep on talking about many different biological pathways in which curcumin might be beneficial. It's been studied on many different pathological mechanisms, on many different diseases, but now we're going to enter the next section when we're going to see a bit about this applied in human health in practice. So now we're going to talk about the practical use of curcumin, mainly using information from human clinical trials. When we think about the medical use of curcumin, we have an obstacle. That is that curcumin has a low bioavailability. What does it mean? What does it mean to have a low bioavailability? It means that when a person ingests conventional curcumin, it is little absorbed, it's rapidly eliminated, it's rapidly converted into an active substance, and very little of it actually reaches the organ and the tissues that we need it to reach to have its medicinal effect. When you give a person conventional oral curcumin can also be given intravenously, but it's a little bit more risky. The risk of side effects is a little bit bigger. We don't have as much studies, so usually when we use curcumin as a supplementation, we give it orally. And when you use conventional curcumin, that means curcumin that doesn't have any special preparation or formulation, even if you give a high dose of oral conventional curcumin, you usually don't raise the blood levels of curcumin significantly. Here we have some studies that used high levels of oral curcumin. One even gave 8 grams of oral curcumin to patients with pancreatic cancer, and even this extremely high dose of curcumin was not enough to generate very high levels of curcumin in the blood. This difficulty to administer a significant amount of curcumin to the organs and tissues makes it difficult to use conventional curcumin for medical purposes. That's why there have been developed many new formulations, new delivery strategies for curcumin. Many different preparations have been developed to improve absorption, to reduce inactivation, and to enhance the delivery of curcuminoids to target organs and tissues. Many of these technologies have already been used to the same purposes for other medical substances. We have some of the most traditional formulations, and these are usually also the oldest formulations. The most famous one is the association of curcumin and piperine. Piperine reduces the degradation of curcumin, so it lets curcumin be present for longer, to be absorbed for longer, and a higher amount of it reach the desired organs and tissues. But we also have newer formulations, which includes liposomated or phytosomated curcumin, nano curcumin. You don't have to know details of these specific formulations, of the characteristics of each formulations. There are many different formulations. We have here a picture of this paper. This is a very interesting paper, by the way. It was the main source for this class. And here it puts this picture which shows us an organization, so we can understand these different formulations by different generations. We have the first generation, which are usually the oldest. We have the second generation, and we have the third generation, which are usually the newest. The oldest generations usually have a lower bioavailability of curcumin, but they are also the most studied. The second generation, we usually have a good balance of a higher bioavailability and also a good number of clinical studies. And in the third generation, we have a promise of greater bioavailability. Some studies seem to show that, in fact, yes, they give a higher bioavailability, and not only a higher amount of curcumin reaches the organs. When we have the second generation also has a higher absorption, a higher amount of curcumin can reach the organs, but since curcumin is enveloped by a liposome, by some structure that helps curcumin reaches its destination, sometimes this same structure can keep curcumin trapped inside itself and makes it harder for curcumin to be released and reach the cells of the tissue itself. The third generation wants to combine higher absorption, higher bioavailability, and also it doesn't want to keep curcumin trapped inside a structure. It wants to make curcumin reach the destination, and there it wants curcumin to be available, to be free to be used to act on that tissue. The third generation is newer. They have some studies, but it's a lot less than the second and the first generation. The amount of studies with each formulation differs. They are all different forms of curcumin delivery. It's all curcumin. What differs is the biochemical characteristics or the pharmacological strategies to deliver that curcumin, but they are all curcumin. This paper, the paper of this picture, was the main source for this presentation. It's a good source to look into this topic if it interests you. This paper reviews about 250 human clinical trials. It's not laboratory studies. It's human clinical trials of curcuminoids published until June 2022. Since then, other studies have been published. We're going to talk a little bit about them. But it also comments about the characteristics of many of the formulations. It's a very nice paper to take a look at. It also reviews some of the studies for each disease. So, for example, in this paper, it shows that for osteoarthritis, until June 2022, we had 13 clinical studies with 899 patients. For obesity, 11 studies with 744 patients. For non-alcoholic fatty liver disease, 14 studies with 1,132 patients. For COVID-19, 11 studies with 685 patients. For migraine, 14 studies with 1,022 patients. And for diabetes, prediabetes, and complications of these conditions, 30 studies with 2,146 patients. Now another technical part. We're going to make some commentaries on clinical studies of curcumin applied to specific human diseases. You can skip this part, but it's a very cool part. So we have this first paper. So this is a paper from 2023, as we can see here, published on the American Journal of Clinical Nutrition. It was a review, a specific type of review called an umbrella review. that studied the effect of curcumin supplementation on weight loss and anthropometric indices. Let's talk about some definitions, some concepts about the types of study to make it easier to understand not only this study, but some other studies that I'm going to mention along this class. So, this won't be any news to people that are health professionals, but for the lay people watching, a randomized clinical trial is an experimental study in humans. So when we say clinical trial, we are saying that it's an experimental study in humans. Usually, this type of study compares an intervention, in this case curcumin, against either a placebo or other therapy or the standard therapy, which is usually the control group. When we say that the clinical trial is randomized, it means that people are randomly allocated into these groups, and ideally neither the researchers nor the patients know which group each person belongs. We call this not knowing blinding. So usually a good clinical trial that gives robust information is randomized and it has blinding. So people don't know in which groups they belong, if they are either taking the intervention curcumin or if they are using the control or the placebo. So that's the clinical trial. Now let's talk about systematic review. A systematic review is a type of a review of literature, but it follows specific rules. It follows these specific rules to achieve a better quality of its information, of the evidence it tries to give. And what is a meta-analysis? A meta-analysis is a type of statistical analysis usually done inside a systematic review. So, a systematic review may or may not have a meta-analysis. It will depend if the studies that comprise the systematic review are similar enough to be compared, to be joined using a meta-analysis. Sometimes they're not, other times they are. So meta-analysis is just a tool, a type of a statistical analysis that puts together the results of multiple studies. And what is an umbrella review? An umbrella review is a literature review made by combining previous reviews. So, if a systematic review, for example, a systematic review of clinical trials is a review of the literature that is made up of different clinical trials, and it follows specific rules for which clinical trials qualify to be included in the systematic review. An umbrella review is a review made from many different systematic reviews. So it's a review combining many different reviews. So, back to the paper. This is an umbrella review of many previous systematic reviews. So, in this trial, after they selected all the studies, they selected a total of 50 randomized clinical trials. RCT stands for randomized clinical trials. So, it was not 50 patients, it was 50 different studies. And what they saw that yes, curcumin supplementation significantly reduced BMI, body weight, waist circumference, and that the curcumins that were enhanced from a bioavailability standpoint further reduced these metrics. And these benefits were seen among many different patient populations. This figure here on the right is called a forest plot. This is a type of figure that is usually seen in meta-analysis. Let's talk a little bit about it. So here we have a line, a vertical line, and we have these diamonds. Each horizontal line is a different study. So, for example, here we have some studies that were about patients with type 2 diabetes. Here some studies that were about patients with obesity, here with non-alcoholic fatty liver disease. Each line, sorry about that, that was my snack coming out of the oven. Back to the forest plot. So, each line is a type of study. When you sum up all the lines, you get this diamond. This diamond can be to either side of the line, so it might be to the left or to the right of the line. The side the diamond is on says what was the result if it favors either the intervention or the control. In this example, what is to the left of the line favors curcumin. Both diamonds are to the left, so it means that the result of the meta-analysis favored curcumin. If they were to the right of the line, they would have favored the control. If the diamond touches the vertical line, we say that the result of the meta-analysis was not statistically significant. But since these two diamonds over here don't touch the vertical line, we say that the meta-analysis favored curcumin and the result was statistically significant. These two diamonds were regarding body weight. Here we have regarding waist circumference. And we had the same thing. We have here different studies with different types of patient populations. The diamond means the result of combining all these studies. We have a line on the left. In this case, to the left of the vertical line means that it favors curcumin, and the diamonds don't touch the vertical line, which means that the result of the meta-analysis favored curcumin and it was a statistically significant result. Here we have another study. This study was a systematic review with meta-analysis. This systematic review was made from randomized clinical trials, and this review was interested in the effects of curcumin on glycemic indices, lipid profile, blood pressure, inflammatory markers, and anthropometric measurements in a particular population of patients with non-alcoholic fatty liver disease. And what they found that after making a review of the literature with all the specific rules, 21 studies were eligible. That meant that 21 randomized clinical trials fulfilled all the rules to be included in the review. They were selected for inclusion in the study, and in this case also in the meta-analysis. Sometimes you have, for example, let's say this systematic review includes 30 studies, but only 20 of them can be joined to make a meta-analysis. So not necessarily all the studies inside the systematic review are also included in the meta-analysis. The meta-analysis needs to have studies that are sufficiently similar to be directly compared. But in this case, we had 21 studies that were selected and included for the meta-analysis. They had a total of 1,191 patients, 600 patients in the intervention, the curcumin group, and 591 patients in the control group. All patients had non-alcoholic fatty liver disease, and what they found was that curcumin supplementation was associated with a significant benefit in terms of fasting blood glucose, of measurements of insulin resistance. HOMA-ER is a measurement of insulin resistance. Higher insulin resistance is detrimental. It's the hallmark of diabetes, for example. A beneficial effect in lowering triglycerides, in lowering total cholesterol, in lowering low-density lipoproteins, reducing weight. It was not a very high weight reduction, but it was a statistically significant one, and a reduction of BMI. There were no significant differences in other markers, including some markers of inflammations. After they dig a little more into the data, they saw that it appears that the greater reduction is in interventions that have longer duration, particularly above 8 weeks of duration. One other thing, here we have a very high range of dosage. Either some were 50 milligrams of curcumin, other with 3,000 milligrams of curcumin. Why is that? Because of the different types of formulations. We have many different types of formulations. Some formulations have a smaller quantity of total curcumin, but since they have a higher bioavailability, that smaller amount is sufficient to have benefits. Some other formulations have a higher dosage of curcumin. That's why there is this difference in dosage. It depends on the specific type of formulation. And it also highlights that since there were many different studies with many different types of curcumin formulation, some had a larger number of participants, some were smaller, that makes something called heterogeneity. It means that comparing these studies is tricky, and we can't take all these effects to the letter for granted. We have to be cautious, but overall it seems reasonably safe to conclude that curcumin probably has a beneficial effect on these patients. Here we have another study, systematic review, with a meta-analysis of randomized clinical trials. This study investigated the effect of curcumin supplementation on metabolic, inflammatory, and oxidative stress indices in patients with metabolic syndrome. Metabolic syndrome is a condition when the patient usually has a mixture of hypertension, obesity, some disturbance of blood lipids, and insulin resistance or diabetes. It has a specific criteria, but overall, since these conditions share some mechanisms, they sometimes are grouped, and we call this group a metabolic syndrome. And studying these patients, this systematic review included 13 randomized clinical trials, and what they found was that compared to the control group, the groups that took curcumin had a positive effect on waist circumference, fasting blood sugar, diastolic blood pressure, high density lipoprotein, TNF alpha. If you remember the second class on the health and disease series, TNF alpha is a marker of the inflammatory response of inflammation. So the higher the TNF alpha, the more inflamed the individual is. And MDA. MDA is malondialdehyde. It's a measurement of oxidative stress. These improvements were statistically significant, and there were some other measurements that in the studies didn't achieve statistical significance. Here I highlight some sections of the text of this study that talks a little about adverse events, saying that overall, reported adverse events were mild, usually from the gastrointestinal tract, diarrhea, nausea, constipation, especially with higher doses. Here we also have two studies. In the left, this is a randomized clinical trial that studied the effect of curcumin on the cognitive function in women with premenstrual syndrome and dysmenorrhea. And what they found was they had a total of 124 patients, 62 in each group. The patients received either curcuminoids or placebo for 10 days, 7 days before and 3 days, from 7 days before to 3 days after the onset of the menstrual bleeding, and over 3 menstrual cycles. And what they found was that in this study, the administration of curcumin had benefits on memory, on inhibitory control, on attention, and on total cognitive ability. And that curcumin was safe and well tolerated in these patients. Here on the right, we have a systematic review of controlled clinical trials that investigated the effects of curcumin on the treatment of prostate diseases. So this systematic review included 11 studies with a total of 745 patients. 8 studies were conducted on patients with prostate cancer and 3 were on other diseases of the prostate. So here we have a review that didn't investigate a particular condition, it investigated a number of conditions of the prostate. And overall, in some studies, had beneficial effects, either on blood markers of prostate health, like PSA. Some studies reported benefits on quality of life. Some studies reported benefits on blood markers, on symptoms. Some patients with prostate diseases have a feeling that they couldn't completely empty their bladder. Sometimes they have a higher urination frequency. They have urgency. They have a weak stream. They have to wake up in the night to urinate. And curcumin turmeric had no significant adverse events among patients in this review. So, this review concluded that curcumin might have some beneficial effects, but it was controversial. There were studies that had a positive results, other studies showed no effect. So there is the possibility, but it's not so clear. That's one of the reasons that some of these agents from phytotherapy, like curcumin, for example, curcumin is a type of phytotherapy, they are controversial. Because when you study a single disease, sometimes you clearly have a benefit, on other times it's controversial. But usually, curcumin, since it acts on many different mechanisms, it might be beneficial to the most relevant problem for that person. For example, here to the people with prostate diseases, the prostate condition is the most relevant condition. But it might also be beneficial on other conditions of the patient. But it's hard to evaluate this broad context of health on a systematic review, on a randomized clinical trial, because by definition they try to focus on a particular question to achieve a more robust conclusion. So usually you have to balance specificity. You have to balance specificity with a broad interest, for example. Here we have a trial of vitamin D and the association of curcumin plus piperine on patients with systemic lupus erythematosus. So, in this trial, they had 45 female patients. They divided them into 3 groups. The first group received vitamin D. The second group received the curcumin plus piperine association. And this was group 2. And the third group received vitamin D plus curcumin and piperine. And they measured the autoimmune disease activity, they measured fatigue, they measured markers of both inflammation and inflammation control response. The body has mechanisms to induce a more inflammatory state. One of these mechanisms include, for example, the production of interleukin 6. So the higher the levels of interleukin 6, more inflammatory activity you usually have. When the body is trying to change its response to control inflammation, it increases TGF beta here. So when you see an increase in TGF beta, it means that the body is trying to control the inflammatory process. And what they saw in this study was that the groups that received, all groups actually had a benefit. But the curcumin and piperine plus vitamin D group had the most benefit, including lupus disease activity, reduction in fatigue, reduction in interleukin 6, and increase in TGF beta. So, even though vitamin D, even though all patients improved somewhat, the group that received both interventions had the best improvement compared to the other two. Here on the left, we have another randomized clinical trial. This was a clinical trial in pediatric patients with intractable epilepsy. Intractable or refractory epilepsy is usually defined as a patient with epilepsy that still has epileptic episodes, even though it has used 2 or more different medications at appropriate dosages. That's one of the definitions. And usually it's a very delicate condition, especially in pediatric patients. So here they had a small number of patients. They have 22 patients, and they divided the patients in 2 groups. One group received curcumin, and the other group received placebo. Each group used their respective treatment, either curcumin or placebo, for 4 weeks. Then, after 4 weeks, they had a 2-week that neither group used anything, neither curcumin nor placebo, and then they switched. The group that used placebo used curcumin, and the group that used curcumin used placebo for another 4 weeks. And what they found was that when the patients were using curcumin, they usually had a reduction in the amount of seizures the patients had. This is a very delicate situation. The condition itself is very delicate. We have many different options to treat epilepsy. It's very delicate to use newer medications, especially in pediatric patients. And this is, in absolute terms, a clinical trial with a small number of patients. It's a very encouraging result, but in fact more studies are necessary specifically to study epilepsy, or the effects of the benefits of curcumin in the treatment of epilepsy. Here on the right, we have a systematic review and meta-analysis of randomized clinical trials, this time interested in the effect of curcumin supplementation on symptoms of anxiety. And what they found was that they included 8 randomized clinical trials with a total of 567 patients, and curcumin had a positive effect in reduction of anxiety symptoms. They say that more studies are necessary, but it's a very encouraging result. Here now we have another systematic review with meta-analysis that is interested in the effects of curcumin on patients with rheumatoid arthritis. So it was a systematic review with a meta-analysis. They included 6 studies with 539 patients, and overall curcumin had a benefit on clinical and laboratory markers of disease. So the patients had less pain, they had better range of motion, a smaller number of joints swollen or tender, they had less pain, they had improvements in markers of inflammation, and it was considered safe. In this review, there wasn't a difference on the amount of adverse events between the intervention, curcumin, or the control group or placebo, because people also have adverse events using placebo. Sometimes we call it nocebo effect. So it's not about having or not having adverse events. It's about if the group that used the intervention had a greater amount, a higher rate of adverse events than the control group, because the control group also has adverse events, even if they're using an inactive substance. Here on the left, we have another system, it's kind of an umbrella review. It's a meta-analysis of meta-analysis, this time investigating patients with osteoarthritis. And what they saw was that there were clinical and laboratory benefits to the use of curcumin. The results strongly support curcuminoid supplementation in relieving pain, improving joint mobility and stiffness, and shortening medication usage of patients with osteoarthritis. And here on the right, we have a meta-analysis, a systematic review with meta-analysis of randomized controlled clinical trials for investigating the use of curcumin supplementation on the treatment of COVID-19 patients. So they had a total of 13 randomized clinical trials, and this review found actually a very significant effect in reducing all-cause mortality. The group that used curcumin had 38% of the mortality of the other group. It's not a 38% reduction. The mortality in the curcumin group was 38% of the other group, a 62% reduction. And they had also a smaller amount of patients that didn't have recovery. That meant that the risk of having no recovery was smaller in the group of patients that received curcumin compared to the other groups. This is a very delicate situation. This review was published in 2023. COVID is a new disease. It's been very studied. This is a very encouraging result. It means that curcumin is probably safe and effective and beneficial to these patients, but we have to be careful, especially when we have great results. We call this a big effect size. The size of the effect was very large in this case. We have to take a lot of care in these scenarios. We have to take this with a grain of salt, but it's a very encouraging results and it merits further studies. This review highlights the limitation of these studies. Some studies had small sample sizes, different formulations of curcumin, but overall it points towards a very interesting benefits for these patients with the use of curcumin. Here we have a clinical trial investigating the use of a specific formulation of curcumin called Meriva. It's a second generation formulation to alleviate the adverse effects of different types of cancer treatment. So they studied 160 patients, they used chemotherapy, radiotherapy, and overall they saw that the patients used curcumin had a smaller amount of adverse events related to cancer treatment. You saw on the previous slides that curcumin is being studied for the treatment of people with cancer. And there are some clinical trials, some studies for treatment of patients with cancer, either using curcumin to directly treat cancer or using curcumin to improve the tolerability of the treatment to reduce the side effects. But people with cancer, patients with cancer, are a very specific population. Sometimes a mechanism that is usually beneficial for a person without cancer might not be beneficial for a person with cancer. It depends on the type of cancer, it depends on the line of treatment that is being proposed to that specific patient. Sometimes the use of curcumin can antagonize the effect of chemotherapy or radiotherapy, for example. Sometimes we want to cause oxidative stress in the tumor, for example. We use oxidative stress to kill tumor cells. It is one of the treatment strategies. And if you give a substance that diminishes oxidative stress, like curcumin, sometimes it might not be beneficial to that particular patient. Other patients with cancer might benefit from this intervention. But the message here is that the management of the treatment of people with cancer is a very delicate situation, and it must be a multidisciplinary team of people experienced in treating this specific type of person. That's why I don't talk a lot about the use of curcumin in the treatment of cancer here in this presentation. I'm not the best person to talk about this. it is studied to that use. There are clinical trials about that, but since it's a very delicate situation and its use is very specific, and it has to be done with a multidisciplinary approach, I won't enter into too much detail here, but it exists and it might be interesting to some patients with cancer. Here on the right, we had another study that investigated the effects of curcumin in this kind two forms of a formulation called teracurcumin. It's a second generation formulation, if I'm not mistaken. Either a regular teracurcumin or a form they called super teracurcumin, compared to placebo, and they investigated Japanese patients with common cold. And what they found was mainly that there was the people that use curcumin, independent of the type of curcumin, had a shorter number of symptom duration. So the groups that used curcumin had a smaller number of symptom days when you sum the total days of symptoms of every patient. It means that the use of curcumin shortened symptom duration. So it's a very interesting result. Well, now we get to the next section that is about the precautions we need to have when we use curcumin for medicinal purposes. So here we're going to talk a little bit more about the safety of curcumin and adverse events that might happen when using curcumin. So the topics will be general safety and adverse events related to the medicinal use of curcumin. We're going to talk a little bit about the use of medicinal curcumin on people with conditions of the gastrointestinal tract. We're going to talk a little bit about the effects of curcumin on nutrient absorption, and we're going to talk a bit about the effect that curcumin has on coagulation and bleeding. So let's talk a little bit about general safety of curcumin. Overall, most studies say that curcumin has good safety profile. Most studies consider curcumin safe and non-toxic, even when using curcumin at higher doses. We have here some extracts of some different studies. You can pause and read them. When adverse events, they are not rare, they happen, but they are usually mild, and usually from the GI tract, such as nausea, diarrhea, and discomfort. Serious adverse events are reportedly rare. They exist, but they are very rare on the literature. Most studies say that there are either no adverse events or mild adverse events. Usually curcumin is avoided during pregnancy. It is being studied for some conditions that may happen during pregnancy, but it's another population that is very specific. We're not going to delve into too much detail about it here. Usually it is avoided during pregnancy unless it's being used for some specific purpose relating to pregnancy, and this is a very delicate situation. It is usually done by a multidisciplinary team with expertise in these scenarios, so it's not the norm. Usually curcumin is avoided during pregnancy. Here we have some other reports about the safety of curcumin in many different reviews, actually, in different patients' populations. So this first review is about patients with knee osteoarthritis. The second is about studies that use curcumin as an analgesic. The third is about the use of curcumin on pediatric patients. Here it was about the use of curcumin as an adjunctive treatment for patients with ulcerative colitis. Here we have a review for the use of curcumin for depression. It had a positive effect and it was overall safe and well tolerated. And here on the bottom right, we have the use of curcumin supplementation to improve sport and physical performance, and it was considered safe and well tolerated. Now, what about the use of curcumin for people who have conditions from the gastrointestinal tract, especially gastritis, peptic ulcer disease? Why this particular concern? Since most of the adverse events are from the gastrointestinal tract, like dyspepsia, there is the burning, discomfort, or sometimes even pain, so that will somewhat relate to the stomach, or usually it is some type of symptom from the GI tract, we make that association. But the literature says that curcumin has been studied for some GI conditions. It is considered safe, and in some conditions it may even be potentially beneficial. It has been studied in patients with peptic ulcer disease, in patients with inflammatory bowel disease. Inflammatory bowel diseases include ulcerative colitis and Crohn's disease, particularly. It is considered safe in these patients, and some studies even show a possible protective effect of curcumin on these patients. Here we have some of the biological mechanisms in which curcumin might benefit these patients. Curcumin might help modulate. Modulate means to balance, let's say. Many different mechanisms that might be beneficial to people with different conditions of the gastrointestinal effects, particularly reflux and what we usually name as gastritis or peptic ulcer disease. Let's talk a little bit over the overall gastrointestinal effects of curcumin. This is a very nice paper. It was published on 2024 that reviews the effect of curcumin and turmeric supplementation on digestive disorders. It says that overall, turmeric or curcumin is safe, and we have a clear evidence of benefit in patients with either inflammatory bowel disease or irritable bowel syndrome. Its effects were inconsistent for the other conditions because we have a high risk of bias, studies with small sample sizes, many different formulations, all the factors that we have already mentioned for the studies of curcumin supplementation in other conditions as well. Overall, well, the literature shows that curcumin might help on the resolution of polyps, especially colon polyps. It might help on the resolution of gastric ulcers and to reduce the activity of inflammatory disease of the gastrointestinal tract. There is no clear evidence of benefit on treatment to eradicate H. pylori so far. We will see what if new studies are conducted about the subjects, but overall, with what we have now, there is no clear benefit about the eradication to improve our rates of eradication when you add curcumin. It might benefit on other aspects, but the rate of success in H. pylori eradication is not higher with the use of curcumin, based on the evidence we have so far. The most established benefits on curcumin supplementation for digestive disorders is in patients with inflammatory bowel disease and irritable bowel syndrome or functional dyspepsia. Let's talk a little bit about the effect of curcumin on nutrient absorption. This is very difficult to talk about because we have small studies, we don't have big reviews, so it's very difficult to sum everything into one presentation. So there might be other effects that I'm not aware of that I didn't found during my studies. Curcumin might, for example, have an effect on the absorption of other micronutrients that I don't talk about here. But what I found the most evidence about, the greater number of studies about, was the effect of curcumin on the levels of metals, particularly zinc, iron, copper, and cadmium. Overall, curcumin might increase the blood levels of zinc, and curcumin might chelate iron, copper, and cadmium. What does it mean to chelate something? To chelate something means that the substance, in this case curcuminoids, bind themselves to another substance, in this case these metals over here, and when they make that binding, they inhibit its absorption. So curcumin binds to the metals, and this new substance is not as absorbed as they were separately. This effect might be beneficial in some scenarios. For example, people may be susceptible to heavy metal poisoning. Cadmium might be toxic, for example. It's most common in people who worked in some industries and they are more exposed to cadmium. There are some diseases that are characterized by metal overload like hemochromatosis. There is an overabundance of iron. Wilson disease, there is an overabundance of copper. It's actually a disturbance of the metabolism of iron or the metabolism of copper, but overall it's a toxic effect of these metals because of that disturbance in their metabolism. And this chelation effect might be beneficial in these scenarios. But in other scenarios, this effect might be harmful. For example, it might facilitate iron or copper deficiency in susceptible patients. For example, women are more susceptible to iron deficiency. Iron deficiency is not a rare thing to happen overall, especially in women because of menstrual bleeding over life. It increases the risk of iron deficiency. So overall, it's best to avoid taking curcumin supplements near iron supplements and to monitor nutrient levels along treatment. This advice, this recommendation also applies to other therapies or even tea. For example, some teas like green tea might also have a chelating effect, especially in iron. Most people will not be harmed about this. Most people don't develop anemia because they use curcumin. But some people might have a susceptibility. So it is interesting to monitor the levels of these nutrients to see if for that particular person a harmful effect is happening or not. So let's talk a little bit about the effects of curcumin on coagulation and bleeding. Curcumin does have some potential effects on coagulation and bleeding. Curcumin has some effects that overall facilitates bleeding. It diminishes the formation of thrombus. Thrombus is the scientific name of clots, for example. Specifically, curcumin may reduce platelet aggregation and the coagulation cascade, the formation of the thrombus. Most of this information comes from studies in laboratory, in animal models, in rats. In some patients, these effects might be beneficial. For example, people with cardiovascular disease, people with COVID, these effects might be beneficial because these diseases, they induce a higher thrombus formation and sometimes they complicate with thrombosis. So this effect of curcumin might be beneficial in these patients. In other patients, these effects might be potentially harmful. It might facilitate bleeding in people who already have some susceptibility. Bleeding happens. Bleeding might happen. In the clinical trial reports, it's very rarely reported in clinical trials. But there are some case reports of it on the literature. And when you talk to people who use curcumin and when you search the internet, people report having bleeding with the use of curcumin. It happens. It's not very common, but it's not so rare. It happens sometimes. Most of the time when it happens, it is usually mild. And it usually happens in people when other risk factors for bleeding are also present. Usually, people who use other medication that might also increase the risk of bleeding. So it may be better to avoid supplementing curcuminoids when there are other risk factors for bleeding present, including the use of common medications like aspirin, clopidogrel, anticoagulants. So to sum it all up, curcumin has a lot of different mechanisms through which it might exert its beneficial effects on many different health and disease processes. Newer formulations allow for better bioavailability of curcumin, improving its medical use. About studies of curcumin in humans, in human health, in practice. Although more studies are necessary for individual conditions, the medical use of curcumin has been extensively studied for some conditions, and there is already a robust evidence of benefits, particularly in conditions of the joints, of cardiometabolic disease, of psychiatric health, and of the GI tract. And about the safety of curcumin supplementation, scientific literature shows that curcumin is a generally safe substance with good tolerability and mild adverse events, mainly from the gastrointestinal tract, like nausea. It's best to avoid its use in pregnancy and when there are risk factors for bleeding. It's advisable to monitor nutrient levels, especially iron, copper, and zinc. And the medical use of curcumin, is best when supervised by a multidisciplinary team. As all of the different tools of the Toolbox series, they don't substitute standard care, it doesn't substitute medication, it doesn't substitute the standard forms of care. It's usually an adjunctive treatment, it's an extra, it's something to some. Some people might get better and maybe don't need as much medicine as they need. We saw that, for example, on some of the reviews for people with joint diseases. It diminishes the need for analgesic medication, for example, but it doesn't substitute standard care, and its medical use should be supervised. I thank you a lot for all your patience and attention. I hope it was helpful and instructive, and I'll see you in the next one. Have a nice day.